Well, good afternoon, Rhode Island and beyond. It's fun to be back with you. I do enjoy our chats we have when we do this. Yeah, obviously the vaccine's a big game changer. I'm excited about it as well. I do want to draw your attention, though, to monoclonal antibodies as well. You know, one of the concepts that's really ingrained in medical school is if you're going to order a test, whatever a test might be, what are you going to do with the result? And I think when we think about testing, we talk a lot about testing. Testing's important because we can do case finding. We want to find the folks that are positive. That's why it's so important to do that surveillance testing the governor spoke about. Because then we want to isolate folks so you're not infecting other people. We want to quarantine the close contacts. But something changed a few weeks ago with testing, and I'm just not sure that message was out there loud and clear. And I just want to bring you back to one of the earliest times the governor gave a press conference. He talked about, you know, we have to slow things down until we get treatment or a vaccine. Well, we actually have both right now. We have a treatment. And I want to spend a moment or two talking about the monoclonal antibody treatment. So President Trump got the Regeneron product. Other people have gotten the Lilly product. They have long names. I don't even bother trying to pronounce them anymore. But monoclonal antibodies are kind of like an instant immune system. They're made in a laboratory. They're infused through an intravenous catheter. If you're wondering what an intravenous catheter is, or an IV, just put a little needle in your hand and one of your veins or your arm, and then you sit in a chair. You sit there for an hour. They just infuse it slowly. You don't feel it going in. It takes about an hour. Then they watch you for an hour longer to make sure you handle the medicine okay. There's a limited supply in the United States of this monoclonal antibody, but Rhode Island's been very fortunate in getting what we're getting. So, my thanks go out to Lifespan. They've done a great job. Dr. Cunha over at Lifespan's done a great job of setting up an infusion clinic. He's an infectious disease expert, done a great job with that. Dr. Erica Hardy did a great job at Care New England getting an infusion clinic together going. So we have a treatment now, and why having a treatment is really important is I really do want to keep you out of the hospital. I mean, I'd love to not have you have this disease, but I want to keep you out of the hospital, and I want to keep you healthy, right? But this is a treatment. This treatment, though, works best if it's given soon in the course of your illness. In other words, if you got so sick you end up in the hospital, the data shows it's too late. The medicine's not going to help you. So I really need to find you early in this. So if you get a test, I have limited supply, right? So what we've done is if you're over 65 and you have symptoms, or you're below 65 and have some of those chronic health conditions that we talked about that put you at risk, I want you to talk to your doctor or healthcare provider about whether or not you qualify for monoclonal antibodies. We've had numerous continuing medical education classes with the doctors. Just so you guys know, we've been doing CME classes with the doctors every other week in Rhode Island, which is pretty cool. We're trying to keep the medical community as up to date. So doctors know this is out there. We have a website that doctors can easily access. They get the referral form. Your doctor can set you up for this. Now, an ID doctor at one of these sites will look at it and make sure you qualify, because this was approved by an emergency use authorization. So monoclonal antibodies are in short supply, but I want to get it to the high-risk people. Nursing home residents, we've got a special allotment for them. People who live in high-density communities, in particular, I want you to think about that. Like, I don't want to spread this to my family, right? So this is out there as a treatment, and I want to throw that out there to you as an idea. So monoclonal antibodies are important, and I want to keep that in the back of your mind. I want to just talk a little bit about testing. I want to talk about my testing experience. So I got tested Tuesday night, and if you're wondering why I got tested Tuesday night, it was because I was coming here today. I wasn't exposed, but I just said to myself, gosh, if I was a journalist, I'd ask Dr. McDonald, have you been tested lately? Because the director got picked up on surveillance, right? And the director was feeling fine. She's just doing the right thing. She's a great example to me all the time. She's one of the smartest, kindest, just good people I know. And she's doing this weekly testing. So I'm thinking I better go get my weekly testing done. So Tuesday night, I'm going to get myself set up for a test, right? So I get up early Tuesday morning, because I wake up every morning really early. It's just part of me. I'm up early every day, right? So I get on portal.io.gov like anybody else would. I look for testing sites. I see there's Wickford Station. I live right next to Wickford Station. So I look for, there's availability the same day. There's availability between 5 and 6. So my day was packed Tuesday, but I had no appointments between 5 and 5:15 at night. And I'm thinking why not? Yeah, let's just go see if this works, right? So I get set up for a test. I leave my house at 2 minutes to 5 on Tuesday night. I left my house. Now I had a conference call at 5:15. So I was back in my house at 5:14 doing that conference call. So that was pretty cool. So then, Wednesday, I'm just going about my day, and Wednesday night, I get a text saying, my results are available in portal.ri.gov/results. I'm thinking like, okay, this is pretty, liking this, right? So I get on the website, get my results, I found out I'm negative. All I'm saying is it worked pretty easily. Why not do this once every week or so? I'm just saying it didn't cost me any money, didn't cost me any time, really. I don't know, it gave me a lot of peace of mind. What was interesting was Gail and the kids, they knew Dad was getting tested. Everybody was pretty calm when they realized I was negative, and I just thought that was interesting. I didn't see that coming. A little bit of family reassurance knowing this isn't in the house. So more people in the family are getting tested. So I just think I want to throw out there as a little endorsement. I want to touch a little bit, though, on Christmas before I wrap up a little bit. So a week from today is Christmas, and just so you know, as a kid, I loved Christmas. As a dad, you have no idea how much I love Christmas. This is huge to me, right? I love getting together with the family. I love doing it. But I want to talk to you a little about the McDonald family Christmas of 2020. Here's what we got planned, all right? So, simpler Christmas this year, right? I got 5 brothers. Mom and Dad are up in upstate New York. We get together. There's 26 of us. We have a good old time. I mean, my family knows how to family, all right? Christmas Day, what I'm going to be doing is I'm going to do a little portal conversation with my mom and dad. We'll have a good old visit on the portal. I have 5 brothers. I'll portal with all their families. We'll have a great time. But we're not getting together, all 26 plus of us. We're just not doing that this year. We didn't do it for my mom's birthday. We didn't do it for Thanksgiving. We just, it's just too much risk. My dad's 90, God bless him. He's still doing good. He's walking and talking, having a good time. Don't get me wrong, he doesn't buy green bananas, but he's happy and doing good. My mom, she's 85, she's doing good too, but we just aren't putting my mom and dad at risk. That just isn't the right thing for us to do this year. So I want to throw this out that this is something that I think is really important. Try to protect your household. One of the things I want to talk about, though, is how do you protect your household if someone in your family has COVID? So this Christmas is going to be different for a lot of families. It's going to be people in the hospital at Christmas, and I'm sad about that. I'll tell you, as a doctor, I never really liked working on Christmas, but I had to sometimes. But I used to make it fun for my patients. But there's a lot of patients there this year. But if you have someone in your family who has COVID, one of the things you can do right now is, some of you might notice I'm wearing a different mask than I usually am. So this is a KN95 mask. It provides source control, so I protect you, but it actually gives a fair amount of protection for me from the rest of the world around me. So a KN95, you can actually get these on Amazon. So I'll show you, here's what I got here today. I bought these on Amazon. They're not that expensive. They come in little packages of 5. And I'm thinking if you have a COVID positive person in your house, or you think you might at some point, this would be a good thing for the person who has COVID to wear if they can, if they're comfortable wearing one, but for the other family members to wear as well. If you have someone in your home who has COVID, if everybody wears a mask, that's best. Now keep in mind, we do want you to isolate inside your home. If it's possible, you want to have your own bedroom, your own bathroom, if you can do that kind of thing. Not every home's set up that way. But a mask inside your house is a way to protect your family. So, it sounds kind of depressing what I'm talking about. Christmas sounds a little bit different, but I was inspired as a kid by a Dr. Seuss book. I think you know where I'm going with this, my friends. How the Grinch Stole Christmas, right? And I just want to read you a couple lines from How the Grinch Stole Christmas, because it's a decent story, right? And I tell you, I identify with the folks of Whoville. You might have picked up on this a long time ago. I'm somebody who identifies with the folks from Whoville, right? So even though the Grinch stole their presents, the ribbons, the wrappings, the tags, and the tinsel, the trimmings and the trappings, the residents of Whoville knew Christmas doesn't come from a store. It means a whole lot more. And folks, Christmas does mean a whole lot more to a lot of people. The holidays, for anybody who celebrates any holiday, they mean a whole lot more. And I want to have perspective about this, right? This year, it's been weird, right? A lot of depressing things have happened. There's been too much loss. Way too much bad has happened this year. But really, it's just this year. I am very optimistic about our future, Rhode Island. And I tell you one thing, I think about this, like if you've ever driven your kids on a family vacation, I've done this too. My Christopher, God bless him, he's 17, but oh my gosh, even to this day, I hear, are we there yet? Are we there yet? And I think so often, this feels like a vacation that just won't end. We're driving like who knows where, right? And my friends, is that we aren't there yet, but boy, we're going to get there soon, and it's going to be awesome. And I just want to say that is like, the summer of 21, oh my gosh, folks, it's going to be outstanding, all right? We're seeing great stuff with the vaccine. I'm so thankful for as far as we've gotten here. And so with that, I just want to say, look, this Christmas is going to be different, but it's going to be setting us up for a great 2021.